Okay, so let's dive right into a really unusual medical mystery. And it all starts with a very peculiar sound. Now, I'm sure many of you have heard of tinnitus, right? That common ringing in the ears. But what we're about to explore is something completely different. It's way more specific and, as we're going to find out, often way more significant.
So yeah, we're not talking about that high-pitched, static-like noise that so many people get with hearing loss. Nope, this is an entirely different beast.
What you need to imagine instead is a sound that has a very distinct, and honestly, a pretty unnerving pattern. It's this rhythmic whooshing, or a thumping, or a throbbing that feels like it's coming from deep inside you.
This is what's known as pulsatile tinnitus, and the name says it all. It's a sound that keeps perfect, steady time with your own pulse. As your heart rate goes up, so does the sound. When your heart slows down, the rhythm in your ear follows right along with it.
So here's the crucial difference. Unlike regular tinnitus, which is often a brain processing issue, this pulsing sound frequently points to a physical, identifiable cause. And that means the investigation has to begin.
This is where doctors really have to put on their detective hats. I mean, look at this list of potential culprits. It's long, it's varied. It could be anything from hardened arteries and high blood pressure to rare tumors or even abnormalities in the brain's veins. Every single one of these possibilities requires a totally different line of inquiry.
So the investigation follows a pretty clear path. You start with a thorough exam, of course. Then you move on to advanced imaging, MRIs, CT scans, to get a really detailed look at the blood vessels in the head and neck. Blood tests can rule out other issues like anemia, and then in some cases, you actually need a lumbar puncture, a spinal tap, to measure the pressure of the fluid around the brain.
All right, let's zoom in on one of the biggest suspects on that list, a really mysterious condition that involves hidden pressure building up inside the skull.
It's called idiopathic intracranial hypertension, or IIH. And the name basically means high pressure inside the head for unknown reasons. For a while, it was actually called false brain tumor because it causes a lot of the same scary symptoms like severe headaches and vision problems, but without there being any tumor at all.
Now, what's really fascinating about this is who it affects. IIH is a staggering 20 times more common in women than in men, and it particularly targets women between the ages of 20 and 50, and there's also a very strong link to being overweight.
While these awful, persistent headaches are usually the #1 complaint, that pulsing sound, or pulsatile tinnitus, is a huge piece of the puzzle. In fact, it's often the very thing that finally brings people to the doctor. It's like an audible clue to this invisible pressure that's building up inside their head.
So this brings up a really interesting question, right? How in the world does high pressure around your brain create a sound that you can hear in your ear?
Well, the mechanism is actually surprisingly mechanical. All that high pressure from the fluid around your brain literally squeezes and compresses the big veins that drain blood away from the brain. Just think about what happens when you step on a garden hose.
And the result is a massive change in how the blood flows. Normally, it's smooth, it's silent, it's efficient. But when that vein gets squeezed, the blood is forced through this tiny narrow section, and the flow becomes chaotic and turbulent. It's rough.
And that is the key. The whoosh you're hearing isn't your actual heartbeat. No, it's the sound of that rough, turbulent blood flow as it rushes through that constricted vein, right past the delicate parts of your inner ear. You are literally hearing a traffic jam in the plumbing of your head.
So, okay, we've connected the pressure to the sound. Now, how do we fix it? Well, the good news is that for this condition, there are some highly effective ways to finally get some silence.
The first approach is pretty conservative. You focus on reducing the overall pressure in the whole system. For a lot of people, weight loss can be incredibly effective. And that's usually paired with a low-salt diet and specific medications, like acetazolamide, which actually help the body produce less of that cerebrospinal fluid.
But sometimes that's not enough. For patients whose symptoms just won't go away, or more seriously, if their vision is at risk from the high pressure, you need a more direct solution to fix that plumbing problem we talked about.
And that's where a minimally invasive procedure called venous sinus stenting comes in. It's amazing, really. Surgeons guide a tiny catheter through a vein in your leg, all the way up into your head to that exact narrowed vein. Then they deploy a tiny, self-expanding mesh tube, a stent, that just pops the vein open from the inside. And the results? They're just remarkable. One major analysis showed an 87% improvement in overall symptoms. And even more importantly, that dangerous swelling of the optic nerve, It was resolved in 90% of cases. So you're not just saving vision, you're silencing that rhythmic whoosh for good.
So, if there's one thing to take away from all this, it's that a persistent rhythmic sound in your ear that matches your heartbeat should never, ever be dismissed. It's not just some annoying noise. It can be a really important signal from your body, a clue that something is wrong, but often something that's very treatable.
I mean, think about it. This whole complex medical journey started with a sound that would have been so easy to just ignore. It really makes you wonder, doesn't it? What are the quiet whispers our own bodies are telling us? And are we paying attention?